Hello, everyone. I'm Jen Rumbalski, the Director of the Health Department for La Crosse County, and I'm going to give you a brief overview today of our new Coulee COVID-19 Compass, which is a data dashboard that is available to you. I'm going to take you through the landing page, show you a little bit about how to use the tool, and give you a little bit of context with what the tool provides. So to start out with, I just want to lay the foundation with the fact that we have had a strategy coming into the development of this tool and all of our response to COVID-19 from the health department. And that includes the primary goal is to prevent disease in the first place. And that really happens a lot by having information available, such as this tool, to help make good decisions across our community, from the individual level to the business and population level, so all can make good choices based upon information. Secondly, preventing the spread of disease, which is when we have a case, a confirmed case, that we're able to quickly reach contacts and decrease the spread of disease. And then lastly, preventing death from COVID-19, and that has a lot to do with our healthcare systems and their capacity. So you'll see all of those aspects in the Coulee COVID-19 Compass product. In addition, I just want to remind you that this will be updated every week on Wednesday, and there will be a Compass dial that will show you the current week's status and the previous week's status. So let me just dig into the tool now and show you a little bit about what you'll see. It is available on our website. So if you go to lacrossecounty.org/COVID-19, you will see this on your website. And what this will show you is, first I want to just point your attention to, this is the landing page, the first page that you'll see. This image of the compass is important. I'm just going to zoom in a little bit and show you this image. So there are 4 colors that coincide with risk levels, and those colors continue throughout the tool to make it recognizable as to which risk level we're talking about. So red is severe risk, orange is high risk, and that is where we currently are, is in the high risk. Yellow is moderate risk, and green is low risk. So there is not a no risk portion of this compass, because at the point where we are in no risk, it likely will not be until we have a vaccine available and are able to get vaccinations out to our community members to increase immunity and the ability for individuals to fight off this virus if they're exposed. So the best category here is green, and that is low risk. So there are 3 separate status lights, and the first one is epidemiology. And this is a word that really tells us what the disease is doing. So within this particular area, we look at everything from the number of cases to the trend in cases as a number and as a rate. We also look at what the disease is doing over time, how quickly the number of cases doubles. There's a number of pieces that come into play here. Secondly is the healthcare capacity, and this really tells us a lot about things like the ability for our healthcare systems to be ready for a surge of patients. Do they have enough personal protective equipment in case they got a number of patients beyond the norm, things like that. And then lastly, public health capacity, and this area really looks at public health's ability to get the cases quickly from the lab, and our ability to contact the cases quickly and get the information we need to determine contacts, and then our ability to reach the contacts. So for example, if a case did not come to us quickly enough, then that person might be exposing others unnecessarily without knowing it. We want to get that quickly and have that conversation to let them know what their status is of their test and what they should do in order to prevent the spread of disease to others. And likewise, if they had 15 or so contacts, we need to reach those folks and let them know they may have been exposed and what they need to do to decrease the risk of spreading it to others. So you'll see here that epidemiology, this category indicates our metrics or our data behind this light have not been met. So our goals here are not met. And predominantly this has to do with testing. We're closing the gap in testing, but we do have some work yet to do in that area. In addition, while our number of cases is less than 10% of our total population, we have increased a little over 100% from the 2-week period prior to the most recent 2-week period. So we always compare the most recent 2-week period to the previous 2-week period, and we want to see that the case numbers are going down over that length of time and not up. And right now they are going up. We have met the metrics or the data behind healthcare and public health capacity. So that puts us then in this high risk category, which is orange. On this landing page, it will tell you about this dashboard. It gives you information like I just explained. In addition, it gives you a little how to use section here and talks about the colors and what they mean and some of the other aspects of the site. Along the top here, when you hover over this, you will notice that there's a bar. And again, like we are currently in the Coulee COVID-19 Compass overview, the bar can be moved all the way across here and you can click on any of these categories at the top. Predominantly, I think your first and second page are going to be the most important and useful to the most individuals in our community. So I'm going to show you this second page. On this second page again, you see this same compass figure. We are in the high risk category. I'll mention here that each week when we update this, if our risk stage changes, say next week we get better, then we will see that indicator in a new category, but we'll still see a lighter color of this indicator to high risk because we want to show which stage we're currently in and what stage we were in the week prior. So again, color coded. When we look down this page, there are 2 important tables on this page that I want to bring to your attention. The first one is about individuals and households. So this helps you again, which category are we in? By color, we're in high risk. So this gives you guidance about, first and foremost, I will just say you should always stay home if you have any symptoms consistent with COVID-19. Any symptoms, even if mild, you should always stay home. Along the left-hand side, you'll see there's recommendations then relating to leisure travel outside of La Crosse County, and if that's by car versus by plane or cruise, because the risk levels are different. Physical distancing and fabric face coverings while in public, including shopping. So there are recommendations by stage. And then attending social gatherings. I do want to point out that social gatherings are one of the higher risk areas for the spread of COVID-19, predominantly when it's indoors. So if we can have gatherings right now, it's 50 or fewer people outside. So we can have gatherings up to 50 people. And we should still be wearing fabric face coverings or doing physical distancing of the 6 feet. If it's indoors, however, you'll notice the number of people is lower because the risk level indoors goes up for a number of reasons. Same thing with visiting a restaurant or a bar, indoors versus outdoors, protecting yourself in the workplace, which is important, another area where spread can occur, and personal care services. Then you'll see, this is just a list of the high-risk travel locations for you to reference, and that connects to the table above. And this is the second table that looks at businesses and establishments. So this will tell you about the risk and recommendations in that risk category based on what type of facility. So congregate long-term care facilities, public and private schools, child care centers, summer programs, higher education. There's kind of a big amount of information here, or a lot of information based upon what you're looking for. This is businesses, workplaces, and faith and spiritual communities, office spaces, again, bars and restaurants, retail establishments, shopping malls, gyms and recreational facilities, salons, tattoo parlors and spas, lodging, campgrounds, faith-based services, and the list goes on here. And in recreational activities, low contact recreational activities, high contact outdoor playgrounds and splash pads, golf courses. And then lastly, under mass social gatherings, this might be an important area to consider between indoor and outdoor mass gatherings again, and then entertainment. We're still in the 15, same as with individuals and household table, 15 inside, 50 outside. So this is basically an overview of the most important pages on this site, but do know that there is a lot of information, sorry about the scrolling, a lot of information available about how the compass is calculated, epidemiology of disease, the different metrics in those categories, the metrics in the healthcare capacity and public health capacity categories. And then the last one here is an isolation and quarantine flow chart for individuals and businesses, so you can reference that as well. So we don't want this to be overwhelming. We want this to be a tool that is helpful and useful to you. So we will be putting out a feedback form. Let us know if you have feedback about things we can improve with the tool to make it easier for you to use. Again, just want to reiterate that though we have improved in our risk level from severe to high risk, and we do see some less restrictions than we've had in the past, we do need to remain cautious. The risk is still present, and we definitely need to be following the guidance within the categories. So please reference this and use the tool to help you make good decisions about what you are doing and planning, and you know, wearing your fabric face coverings and those types of things. And if you have any questions, I'll just close with the ways that you can contact us. So first of all, you can send us an email at covid19@lacrossecounty.org. You can also call us at 608-785-6240, or you can also find us on Facebook and you can send us a message on Facebook. So hopefully this has been a helpful tutorial for you to learn about this new data tool on our website, and that it will be a tool you can use to make good choices going forward. Thank you.